Hello, my name is Dr. Khadija, Daktari Mbeneka, Kenya, and today I want to tackle a topic that I realized that I thought people know about these things, and then I realized that people don't know. I'm going to do this video just off my head. I'm not reading anywhere, just from my experiences. So through my contact with my friends, with my cousins, with my relatives. So I came to realize that so many girls who are aged don't realize what they need to know about their bodies as they await, marriage, or as they await opportunities for childbirth. And it's a worrying trend, because right now we have to agree that the society is such that girls are getting hitched or married quite late right now because of career, because of education, because of other opportunities. So it's not uncommon to see girls get married when they're 40, 45, or above the age of 35. That's like the common phenomena right now. So it's important for these girls to know things that they need to keep track of in their bodies, because a body of a 13 years old and a body of a 37-year-old are definitely not the same. Okay, so first things first. So number one is if you have been sexually active, then you need to do your cervical cancer screening as per guidelines, and I did a video on this before. And if you're above the age of 30, you also need to do human papillomavirus tests. This is very, very important. Okay, so I'm going to attach a link to the video that I did on cervical cancer screening in the description box. Then number two, as a woman who is aging, no children, no plans of settling down soon, you need to know the status of your reproductive organs, right? So it's not uncommon for girls who are 36, 37, finding out that they have fibroids and they're trying to conceive. Okay, so you need to do at least that annual scan, then check if you have uterine fibroids, check if you have ovarian cysts, etc. And if you have fibroids, just get to know what is the size, what is the location, are they growing over time, or are they constant, or are they worsening, or could they affect your future pregnancy prospects? It's good to know this. I have seen so many girls who are like 26 get huge fibroids. I have seen girls 35 get married, then trying to conceive, they realize, oops, we have multiple fibroids, some of them submucosal, etc. So just do that scan every year and get followed up by a gynecologist. And it also keeps you, it helps you to keep things in perspective, because you'll know, if I have fibroids, then I know that I need to rush, I need to I need to be very careful, and more, especially if they're growing very fast. And if I want to have children in the future, then I may need to speed things up, as opposed to somebody who has no fibroids. The number three, you need to keep track of your menstrual cycle. Like, if your cycle is not regular, especially if it starts misbehaving, like in your late 30s and you're single, please get checked. You could be getting into perimenopause, yeah? Or you could be having other issues which are better handled, you know them right now, like polycystic ovarian syndrome, etc. Make sure that you check and you know your menstrual regularity. Track if you're ovulating every month. Yeah, and there are different ways of tracking this, and one of the most common thing is the Mittelschmerz pain, which you'll feel on one side, either right or left, once at the middle of your cycle. Just it's good to just feel and know, okay, this month I ovulated. I ovulate every month. I have a regular menstrual cycle. If not, you may need to get things checked. Then, number whatever, I'm just giving this off my head. Another thing that you need to be careful with is protect your fallopian tubes with your life. Once those tubes are blocked, once those tubes go, there's no going back most of the times, and so you might end up having some difficult consequences. I'm not saying that everybody who goes through IVF eventually has like blocked tubes. No, it's not true. But if you are careless with your tubes, then you might end up getting some repercussions that may not be very appealing in the future. So stay away from any infections, stay away from any STIs. If you're sexually active, then keep a very safe sexual practice. Any infection, whether it's just candida, let it get treated. Don't ignore anything. Like bacterial vaginosis, avoid. Chlamydia, gonorrhea, things like abortions, avoid. Then another thing that one needs to know is avoid things that could impair your ovulation. Like I have seen women who use like their emergency pill like 4-5 times in a month, and you're like, what's wrong with this person? So if you must be in a family planning method, make sure that you're in a family planning method that does not have very severe repercussions, and a family planning method that is reversible and that does not cause a chronic an ovulation, that does not suppress your egg production chronically. It's important to know this. Then another thing that you need to know is stay healthy, eat well, exercise, keep a good body weight. If you can if for example there are prospects of trying to get a baby, you can take prenatal vitamins. There's no harm. Just keeps the balance of minerals and everything in your body. Personally, the day I got engaged and it was confirmed that tumekuposa, this is your wedding date, I started taking antinatal vitamins. It's good. It's a good habit, So like I have a variety that I can show you. This is not sponsored, so I'm just doing what I know. This has always been my favorite, the Jamieson prenatal vitamins. They're chewable, very nice. It has a very good composition of everything, all the way, including calcium, etc. Very, very good. This one is a bit expensive. It's like 2,700 for I think 90 or for 60 tabs, but it's very good. It's very sweet, so it's something that you wouldn't forget to take. Then another thing that you need to another brand in the market is this. It's called Vitamin Angels. It's available in GOK free of charge. It's also very well balanced. It has most of the minerals, but the most important thing is folic acid, because as you age, or as your eggs age, then you're at risk of producing eggs that have what you call aneuploidies, chromosomal anomalies, neurotube defects. So it's good to keep your folic acid levels in the body balanced. So this is Vitamin Angels. Then I have other brands with me. There's this one called Pregnavit M. I don't know the price. I think I was given this a while back by a med rep, and it's good. It's also well balanced. It has most of the things, including calcium. And then another thing that you can take is you can just take the usual folic acid, 400 micrograms on its own, or even just IFAS, and you're good to go. Then another one is Pregnacare. It also has most of the things. It has everything, actually, I think. Although I don't know if it has calcium, but it's good. It's good, Pregnacare. Okay. And then I have other brands. This is Preg Omega. So that's just a sample of what I have in stock with me. And then for me, the day that I got engaged to the day that I realized, okay, so prospects of trying to conceive in the future might be a possibility, like in the near future, so I might as well, because I knew it was like 3 months to my wedding, so I started taking the prenuts, and I've been taking them all through till now. It's good. Then something else that you need to know is what have I left? Like if your age is a bit on the higher side, like 40s and above, then I'll say that you meet your gynecologist. Especially if your menses are not very regular, they may need to do some screening tests just to check your ovarian reserve and to check where your ovaries are. Yeah, because you don't want to now decide to settle down and get babies, and then you realize that, oopsie, you're already in menopause or you have very, very low reserves. Yeah, so there's some tests that you can do. An ultrasound can pick your what you call the antral follicular count. Then you can also do some other tests. There's no standardized test that says that this is a screening tool, but some people can do anti-Mullerian hormone. It is just to know where you are, but this is not for every patient. So people who, for example, their age is a bit advanced and they have irregular cycles, etc. Then another thing, as you age, you're also predisposed to other conditions, yeah, like hypertension, like diabetes. Some people get autoimmune conditions manifesting at these ages above 30, etc. So just get checked. Always get checked. Always have a good, just make sure you're healthy, because you also don't want to now start conceiving and you have pressures that are shooting and are not well controlled, you know. So it's good to always have this checked. And then what else did I leave out? I think that's basically it. In summary, eat healthy, do your annual gynae checkups, do your pap smears or your cervical cancer screening as per schedules. Do at least an annual ultrasound. Just check if you have fibroids and what are the repercussions of this. Are they growing, etc. If there are prospects of trying to conceive in the near future, take prenatal vitamins. Very nice. Then another thing is protect your tubes with your life. Fallopian tubes are very tiny, very, very tiny and very sensitive. Anything going up there could obstruct. And some of these things can cause repercussions that are not very nice, you know. Stay away from chlamydia, stay away from gonorrhea. Stay away from what are even just usual infections. Just and safe sexual practices if you're sexually active. So that's it. Share this video as much as possible and let me know what you think about this and ask me any questions that you have. Thank you very much.